Hello everyone! So today in our project we'll be discussing about maternal health outcomes among African Americans, primarily on preterm birth.
I'm Taryn.
I'm Jonathan.
I'm Alondra.
And I'm Daniel.
And now we will proceed on with our presentation.
First, when talking about maternal health outcomes among African Americans regarding preterm birth, one should define what preterm birth is. According to the Centers for Disease Control and Prevention, also known as the CDC, preterm birth is when a baby is born prior to the 37-week mark in a pregnancy, thus making the baby born too early. Premature birth is a health behavior that causes higher rates of death and disabilities, which, according to the CDC, affected 1 in every 10 infants born in the United States during the year of 2019. In 2018, 17% of deaths before the age of 1 year were on account of preterm birth and birth weight that is low. The infants that survive preterm birth can encounter developmental delay as well as vision and hearing problems, breathing problems, eating difficulties, and cerebral palsy. The Centers for Disease Control and Prevention also emphasize that preterm births may also cause difficulties in emotional and financial aspects for some families. When discussing health inequities regarding maternal health outcomes among African Americans with a specific lens over preterm birth, the Centers for Disease Control and Prevention go over several factors that may increase a woman's likelihood of having a preterm birth and even touches on some important steps that can be taken to help reduce such a risk. One of the factors listed under what can increase the likelihood of a preterm birth is women with low income. This directly correlates to a few of the preventative steps listed: getting prenatal care, seeking medical attention, and talking to one's doctor. Women of lower income will not be able to participate in these preventative steps listed by the CDC because they would not be able to afford them. Thus, major health inequities are then filed under economic, community, and healthcare lenses. Continuing on health inequities with maternal health outcomes among African Americans, specifically regarding preterm birth, another major factor of preterm birth listed from the CDC are women of the Black race. African American women have almost twice the rates of preterm birth as white women, according to the U.S. National Library of Medicine. When looking at the U.S. National Library of Medicine National Institute of Health, a study was conducted regarding African American women and preterm births. These women listed, quote, lack of social support, lack of financial support, interpersonal conflicts, judging, dangerous neighborhoods, racism, and pregnancy and mothering related worries, end quote, as stressors, which further prove how the CDC listings under increased likelihood prove to be true. These stressors also help to point out the health inequities found in the CDC's preventative measures, since they are not as attainable to Black women as they are to other races.
Now we will be going over the theoretical framework. How is this health disparity prevalent within the lives of African American women? To examine this, we studied Adler's model, which was done by Nancy E. Adler and Judith Stewart. This model basically describes ways in which the health disparity is created within these lower socioeconomic status communities. First off is the poverty line. Women below the poverty line experience material deprivation. Basically, what this means is that they are deprived of certain services or they deprived of certain resources, and this leads to differences in morbidity and mortality rates compared to people that are above the poverty line. Secondly, the model describes an occupational hierarchy. This basically means that those at the bottom of the occupational grade have worse health and higher mortality rates. And this also leads to an effect on birth outcomes as well. Infants born to mothers with less education and less income are more likely to experience growth restriction, be born prematurely, as well as have a low birth weight. This disadvantage sets them on trajectories of poorer health, and this also leads into their later adult life, in which they are more likely to be in a lower socioeconomic status. Third, the model describes the mechanisms at which this health disparity is created. First would be differential access to healthcare. People may experience lack of coverage, transportation, availability, as well as costs, and not everyone is able to obtain proper healthcare. And so, that being said, people in lower socioeconomic status communities also experience environmental exposures. Uh, these people are more subjected to more hazards. They have more. They have access to fewer resources to mediate these effects of being in a lower income community. And third is health behaviors and stress. These mechanisms basically point out that behaviors such as smoking are more prominent in lower socioeconomic status communities. Maternal and paternal cigarette use expose children to secondhand smoke, and can lead to short-term health effects such as respiratory problems and asthma, as well as setting the stage for diseases which arise later in life. And the model continues to explain this by stating that individuals in lower socioeconomic status environments are exposed to more stressors. So, on top of like things such as like smoking or less resources and whatnot, they also have to face pressures being in low income communities, and the pressures of being in a low income school, which can create lots of toxic chronic stress.
Now that we discussed the theoretical framework of Nancy Adler, now we can talk about the social factors or pathways on behalf of the biopsychosocial model. And with that, we can talk about the study conducted by Braven and others in 2015, the role of socioeconomic factors in black-white disparities in preterm birth. So in this study, the sample consists of numerous annual surveys from 2003 to 2010 from the California Maternal and Infant Health Assessment, known as MHA, and birth certificate data. Within the specified sample, only 10,400 were identified of being U.S.-born black and white California residents who are women who are after postpartum. And the reason why it is not numerous other diverse backgrounds is because there are many various backgrounds from immigrants and they have various birth outcomes altogether. As in a general overview of the results, there are just significant black-white health disparities within preterm birth. This does not imply that there is genetic factors that comes in play, but however, there is a significant amount of socioeconomic factors that negatively affects both of these disparities of these groups. And moreover, as we can go back to the theoretical model by Nancy Adler, this suggests that there are numerous social and economic factors can play a role in these disparities. A couple of these disparities to list out includes SES, which is socioeconomic status, and environmental influences, which includes chronic stress, racial discrimination of unfair treatment, social support, and family income. Much is it to say that the majority of these factors that I list out are just connected to one another, which ultimately ends up on behalf of the outcomes. In the beginning, we have socioeconomic factors such as African Americans having lower education, having a low occupation and income, especially, which is contributed to the SES. Much of these constraints also contributes to their environment, which is the type of neighborhood they live in, the stress, the environmental stress, such as chronic stress, which contributes to allostatic load, and moreover with racial discrimination, unfair treatment, since there's a lot of institutionalized racism and a lot of discrimination nowadays, which also contributes to the access of the medical care that they can access to. And with that, as more significant people such as white population having a higher wealth percentages than U.S. born and black African Americans. This is relatively known that having a lower percentage income can actually just lead you to a lower health outcome altogether, which is low access to medical care and just more likely to being exposed to carcinogens or just pathogens. Including with the environmental resources and constraints, social support can also be a big factor between African Americans and white Americans, which if you have a bigger social support, you will most likely, get some help and, get some assistance, which you can all together make more to better health outcomes. But if you have like less social support and that just doesn't lead right and just doesn't go to health outcomes because you just feel like you neglect your own health, this will detrimentally affect the outcome of your health outcomes since, neglecting your health, which just eventually leads up to poor rates of preterm birth altogether. One more thing to mention about chronic stress, this can actually just leads to allostatic load, which is in other words, it's the wear and tear on the body. After accumulating a load of a chronic stress that can happen from the social environment or the environment he lives in, which just in terms, you just may make poor health outcomes on behalf of your, pregnancy period altogether. which is just going to increase the chances of having a preterm birth if you just don't take care of yourself, which just leads to a higher mortality rate or more chronic conditions for the baby who was preterm birth. Now we can talk about the psychological factors or pathways that influences African Americans' preterm birth. Now that we discussed about the social pathways or factors that influence African Americans' preterm birth, now we can discuss about the psychological factors and pathways that affects this marginalized group. And moreover, we can start off with a study by Mendes and others in 2014, Institutionalized Racism, Neighborhood Factors, Stress, and Preterm Birth. On behalf of the study, the sample consists of 3,642 pregnant women who participate in the Stress and Pregnancy Study, which also known as Stress Pregnancy and Evaluation Community Project, SPIC, in Philadelphia between 1994 to 2004. Moreover, these researchers took away the 2000 U.S. Census and Home Mortgage Disclosure Act, also known as HDMA, from 1999 to 2004, in order to measure segregation, which is, in other words, is geological segregation by race, which, if you look at that, it's more like related to ethnic enclaves, but more about ethnic segregation, which, like, saying people are just grouped up basically together and they're just being marginalized by these higher ups altogether. On behalf of the overview of the study, there's actually no significance in data as mentioning African American women actually have a slightly lower risk of preterm birth among the population because it's positive correlated with the amount of people around them of the same race. And however, at the other side, there's actually significant data that self-reported poor neighborhood quality was associated with preterm birth among their own populations. But overall, there's no significance in redlining and segregation among all ethnic communities altogether. In connection to our theoretical framework, as we come back to it, and connection towards the biopsychosocial model, which we're looking at psychological factors and pathways, this study actually suggested numerous possible psychological factors that can affect these disparities. As a quick overview, some of the major ones that I pinpointed in this study consist of stress, such as neighborhood violence, which that can be a huge part in affecting psychological issues for these African American women. Chronic stress, as mentioned previously in the social factors, allostatic load, anxiety, which it can be an all-time high for them when trying to manage your life and trying to manage the dangers when living in it. Health behaviors, second of all, such as smoking and overeating. It can be also affected by food deserts. Coping mechanism, also another prominent way to get out of the blue and just get out of the present moment, just to enjoy life and just forget about reality for some time being, and trying to just forget about some circumstances such as neighborhood deterioration, like decaying infrastructure, environmental intoxicants, that can also lead an impact on a person's psychological issues altogether. And lastly, perceived discrimination can have a huge effect on a person's entire life. In other words, saying a person perceives discrimination or has experienced discrimination can also be lead as a big factor as chronic stress, as mentioned before, which can be contributed to allostatic load. Now, in the beginning, stress such as neighborhood violence can also lead a detrimental psychological impact on chronic stress for someone and also increase of anxiety. As a person who has a lot of stress in their lives, that can just contribute to negative health behaviors such as below smoking and overeating. With these negative health related behaviors, it's just ultimately become a negative health outcomes, especially for those who are in the progression of the pregnancy. These health behaviors will coordinate really bad when almost to the prenatal birth of the child, which these child can be secondhand smokers, have chronic conditions they may face over time, and other negative health related behaviors or outcomes. As more ignorant with the lacking control in their lives, they really can't do anything in their lives, and that just contributes to negative health related behaviors, and just smoking and stuff like that, and just more negative health outcomes as well. And moreover, with coping mechanisms for as a way to relieve the stress, that is taken from all paths of life, which can play a huge role in depending whether a person's coping mechanism is positive or negative, which is important, which also just leads to the type of health outcomes he or she receives in the near future. Yeah. This is the same that goes to perceived discrimination. Perceived discrimination is just another psychological influence, which also just influences the allostatic load, which is just stress in other words, and just health-related behaviors, which overall it just affects the health outcomes of this ethnic community.
Mothers can reduce the risk for early labor by following some of these strategies. Following these strategies can be very important so that it reduces the risks of preterm birth. However, it is important to note that some risk factors can't be changed, such as having a premature birth in a previous pregnancy. Other things can be fixed, like quitting smoking. One important thing to do to reduce the risk of premature birth is to get to a healthy weight before pregnancy and gain enough weight during pregnancy, because these will help the baby's survival chances. Another important thing to do is to not smoke, drink, or abuse non-prescription drugs. Also, make sure you go to your first prenatal care checkup as soon as you think you're pregnant. Even if everything is going well, it is crucial to go to a prenatal checkup. They will be able to ensure that you and your baby are fine. Also, make sure to get treated for chronic health conditions like high blood pressure, diabetes, depression, and thyroid problems. These are all very important to reduce the risk of preterm birth. Lastly, reduce the stress in your life. Make sure to eat healthy foods and do something active every day. 3 intervention strategies are usually used for preterm birth. The first one is cervical cerclage, and this is a purse string suture that strengthens and tightens the cervix. Usually it is inserted under regional or general anesthesia, and it is inserted between 12 and 24 weeks gestation and removed at 37 weeks gestation, or if there are signs of labor before this. Next, we have progesterone supplements, and these are usually prescribed as once daily pessaries, and it is the only formulation available in the UK. It is started between 16 and 22 weeks gestation and continued to 34 to 36 weeks gestation. Last, we have cervical pessary, and this is a silicone ring that sits over the cervix and works by supporting the cervix and tilting it posteriorly. No anesthesia is required for insertion, and there's only one cervical pessary on the market, which is Arabin. It is inserted between 18 and 22 weeks gestation and removed at 37 weeks gestation, or if there are signs of labor before this. These are the 3 most popular interventions for preterm birth.
Here's our references, and thank you for listening to our presentation.
Thank you.
Bye.
Thank you.